Brian, glycine keeps getting framed as the brain's sleep switch, a collagen hack, and sometimes even an aging supplement. If someone sees those claims tonight, what is the most honest first sentence?
The honest line is, glycine is essential biology, but the bottle is not automatically essential. It is the smallest amino acid built into proteins, heavily represented in collagen, and used to make compounds like creatine, glutathione, heme, and purines. Your body also makes glycine, and normal dietary protein supplies it. So the key question is not, does glycine matter? It clearly does. The question is, does extra isolated glycine improve a specific outcome in humans? That evidence is much thinner.
So when people say, I need glycine because modern diets are low in collagen, is that really a deficiency story or just a clever way to sell powder?
It is usually not a classic deficiency story. For sleep, the more interesting idea is signaling. Glycine can act at inhibitory glycine receptors, and it also modulates NMDA receptor signaling. Small bedtime studies have proposed that glycine may support peripheral heat loss, which matters because the body normally cools as sleep approaches. That is different from knocking someone out. It is more like nudging a timing signal in a system that already depends on light, routine, temperature, caffeine, stress, and circadian rhythm. But plausibility is not the same as a dependable clinical effect. The sleep evidence that gets attention is small and short duration, often looking at subjective sleep quality or next-day fatigue after bedtime glycine. That makes it reasonable to call glycine interesting, not proven. If someone already has decent sleep habits and still has mild trouble winding down, a short personal trial may be sensible. If they expect a broad recovery upgrade or a cure for chronic insomnia, the evidence is not there.
What about the collagen angle? Since collagen is glycine-rich, could plain glycine powder realistically improve skin, joints, tendons, or hair the way collagen products imply?
It is a biologically reasonable question, but it is not proof. Collagen does contain a lot of glycine, and glycine availability can matter in metabolism. Still, the body does not send a scoop of glycine straight to your wrinkles or cartilage. It digests, absorbs, pools, and allocates amino acids according to many priorities. For skin or joint claims, you would want trials measuring those outcomes with glycine itself, not just statements that collagen contains glycine. Mechanism opens the door. Human endpoints decide whether we walk through it.
I also see glycine tied to glutathione, inflammation, diabetes, fatty liver, and longevity. Are those stronger than the sleep evidence, or are they mostly pathway excitement?
Mostly pathway excitement, with some legitimate research reasons to keep studying it. Reviews discuss glycine and glutathione synthesis, inflammatory signaling, and metabolic disease patterns. But that does not make an over-the-counter glycine powder a treatment for diabetes, liver disease, cancer, or aging. Those conditions deserve diagnosis, monitoring, and therapies with established outcome evidence. If a supplement claim makes someone delay care, skip medication, or ignore abnormal labs, the risk is no longer theoretical. For practical use, I would separate food glycine from isolated glycine. Food protein gives amino acids in a meal context. Meat, fish, eggs, dairy, legumes, and gelatin-containing foods all contribute. A single ingredient glycine powder is easier to evaluate than a sleep blend, because blends may also contain melatonin, magnesium, 5-HTP, herbs, or sedatives. If sleep changes after a blend, you may not know which ingredient did it, and that matters for both benefit and side effects.
If someone wants to test it for sleep without fooling themselves, what would you actually track besides, I think I slept better?
Pick one reason to try it, usually mild sleep dissatisfaction or next-day tiredness, and keep the rest boring. Same caffeine cutoff, same bedtime window, same alcohol pattern, same room temperature. Track sleep onset estimate, night awakenings, wake time, morning grogginess, and afternoon fatigue. If nothing meaningful changes after a short, consistent trial, do not keep escalating just because the mechanism sounds elegant. If there is a clear benefit, the win should be noticeable in daytime function, not only in a wearable's mysterious score.
Who is the best fit person for glycine then? Is it the anxious overthinker, the hard-training athlete, the older adult, or the person who just wants a gentler sleep aid?
The best fit person is someone with mild, uncomplicated sleep complaints who is not using glycine to avoid a real evaluation. The wrong fit situation is persistent insomnia, loud snoring, witnessed breathing pauses, waking up choking, major daytime sleepiness, or sleepiness while driving. Those patterns can point to sleep apnea, mood disorders, medication effects, pain, restless legs, or other problems. Adding more supplement powder can make someone feel proactive, while the actual cause keeps running in the background.
Do we know the perfect dose or timing? Or is that another place where marketing sounds more precise than the evidence?
Marketing is definitely more precise than the evidence. Short studies generally report mild gastrointestinal issues, but long-term high-dose safety is not well characterized. I would be more cautious in pregnancy, breastfeeding, kidney disease, liver disease, or when someone uses sedating medicines, alcohol at night, or multiple sleep products. A clinician or pharmacist can catch interactions and contexts that a label will not. Also, quality matters. Choose a product with clear ingredient labeling, not a proprietary sleep cloud.
So the verdict is not glycine does nothing, and not everyone should take it. It is a small, clean sleep experiment for the right person, while collagen, metabolism, and longevity claims need much stronger human evidence. Is that the latter?